Having looked at the members of the electromagnetic spectrum, having looked at the wavelength or frequency of the sections of the spectrum, the uses and the dangers of each member, I wanted to spend a little time looking at the medical uses of the electromagnetic spectrum with you. You'll often hear me saying how physics has made life better, has improved life expectancy, and has generally contributed very positively to the way we live our lives and the length of our lives. And hopefully you'll agree with me when you see these, just the extent to which physics has made and is continuing to make a big contribution to medicine. So let's look at mobile phones. You'll be aware of a lot of controversy around whether mobile phones are dangerous to the brain. And it is a fact that if you use your mobile phone a lot, clamped to your head, then you will get a temperature rise in the brain. Microwaves are absorbed by water. That's how microwave ovens work. And there's plenty of water in the brain. So the brain absorbs the microwaves and it heats. The question is not, does it cause heating? The question is that heating detrimental? And current research suggests that it is not. Moving on then from radio waves to infrared, this is just an amazing device. This, as you'll have possibly had used with you, certainly you'll have seen it on television or something like that. What this does is to fire near infrared through your finger and detect it on the other side. And with that, because of the way that the blood absorbs the near infrared, you can measure the pulse and you can measure the oxygenation level of the blood, because oxygenated blood absorbs the infrared differently to non-oxygenated blood. So you can detect the pulse and so the heart rate, and you can detect the oxygenation level of the blood pretty much instantaneously. So that's really useful in forming a diagnosis of your patient. But you can also use this near-infrared spectroscopy, that is analyzing infrared, to detect brain activity for the same reasons. So this fashion statement the baby's got on here, this hat, contains near-infrared emitters and receivers opposite each other. And when, although you can't see it on here, this is supposed to indicate what the baby sees, these chessboard-like images flicker. And when the baby sees the flashing lights, the infrared spectroscopy can detect the change in the amount of oxyhemoglobin in the brain. And obviously that indicates a higher rate of respiration. It indicates the brain is working. So you can detect brain function or lack of it using infrared spectroscopy. And again, notice that all of this is without any kind of incision. There's no surgery involved here, no needles. It's completely non-invasive. We can also use infrared to check blood flow through your limbs. You can see that the ends of the fingers are red, indicating a higher temperature than the forearm and the wrist. You can see the blood in the veins here. But if you look over here, you can see that whilst these two fingers are looking fairly normal, these two really aren't. The blood flow in these fingers and all of these fingers might be suspect. And so the doctor at a glance can tell there might be a problem there. Another thermograph showing the heat distribution, temperature distribution rather, on this child's face. And as you'd expect, the eyes are hotter than the edges of the hair, for example, the cheeks. The lips are hotter than the nostrils. So again, it's an opportunity to quickly check the circulation. Here you have a thermograph that's been superposed over an ordinary photograph, and so you can tell where perhaps the circulation is not as good as it should be. These triangles are to allow the two images to be superposed. You can see they haven't quite managed it. There's some mismatching going on here, but you can tell, however, that perhaps the circulation in the backs of the arms is not as good as in the center of the back. Visible light, endoscopy. This is a tremendous innovation. This is allowing light and surgical tools to be introduced into the body, in this case through the esophagus and into the digestive tract. But it could be keyhole surgery, so that a small incision can be made rather than having to make a larger incision to let the surgeon get in with their hands. You can make a small incision, you can put your endoscope and your surgical tools in, you can perform the surgery, and because the incision is smaller, the damage done is less, and so the healing process is faster. So you can have people that would have been off for weeks, only off for days, maybe. So you're improving the patient's experience, you're improving life expectancy because you're doing less major surgery, and you're making an economic contribution to society because people who would have been off work for longer are not. Here you have the endoscope coming into the stomach. This is the inside of the stomach here. This is the endoscope, and this is the esophagus. And you can see, if you know what you're looking at, that the stomach wall has relapsed into the esophagus. This is what is known as a hernia. And that can cause all kinds of discomfort and problems for the patient. So being able to diagnose that relatively non-invasively is very useful. And over here, you can see a parasitic worm. Again, something that wouldn't be so easy to see or detect, maybe without the endoscope. Here we have another variation on that, which is a camera pill, and then combining, again, the video isn't working here, but this would be the view by the camera pill. This is an X-ray showing the position of the camera pill, and so you're able to put the two images together to know what it is you're actually looking at here. This is a further innovation. Rather than actually putting the endoscope inside, using computerized tomography, which is a 3D X-ray, you can make a 3D image of the inside of the body. And thereby you can find problems which would otherwise be very difficult to diagnose. And of course, you avoid the discomfort of having an endoscope put down your throat. You may have had an experience yourself of this, having your retina scanned. This is a very important diagnostic technique for allowing the early detection of problems, possibly in terms of blood flow issues in the retina, but other problems can be, other medical problems can be detected from seeing how the retina is doing. Photodynamic therapy using light to solve problems. Here we have a pigmentation of the skin, which the patient wants rid of, and by firing light at it, intense light, laser light, they have removed that pigmentation. And again, it's non-invasive. Using blue light to treat jaundice in babies, of course. You're probably aware of that. This is a very famous X-ray, if you're a physicist. This is Mr. Röntgen's wife's hand, and here's her engagement ring. If you know anything about engagement rings, that's a diamond, and it's a rather large diamond. And here's a rather more mundane X-ray, and a more recent X-ray of a hand. And here you see the benefit of the CT scan. If you compare the 2D image and the 3D image, this is computer rendered as well. This isn't just an X-ray, but it is using a computer program to render some of the detail. But still, you can see the detail of the foot so much better with the CT scan than you can with an ordinary X-ray. And more of that in a moment. Here you have a CT scan of the pelvis, and here you can see a significant fracture of the pelvis. Radiotherapy, the use of X-rays or gamma rays to cure cancer. We've talked about this before, I think, but the patient is placed so that the tumor, the cancer, is at the center of the circle that this is going to perform. This is either a gamma source or it's an X-ray source. The gamma source would be cobalt-60, for example, and the X-rays are made by firing electrons at a target. But this moves in a circle, and the center of the circle is where the tumor is. And so as this moves in a circle, the tumor is always getting blasted by the X-rays or the gamma rays. But the healthy tissue all around the tumor is getting a much smaller dose. The healthy tissue is less susceptible to damage than the cancer tissue, and so the cancer gets killed and the healthy tissue does not. And cancer, just a reminder, is an uncontrolled growth of cells. And it is because they are rapidly dividing that they are very susceptible to ionizing radiation like X-rays and gamma rays. This is a diagram of that. So this would be your source moving around, firing the X-rays or gamma rays in at the tumor, which is shown in darker pink here, whereas the healthy tissue all around it gets a much smaller dose. Here you have a CT scan of the chest area. You've got the lungs, you've got the heart, and here you've got the tumor. So again, you can see the benefit of the CT scan, the 3D X-ray, because if you had simply an X-ray taken from the front or the back, you would know there was a tumor here, but you wouldn't know where between here and here the tumor lay. But with the 3D X-ray, you can tell exactly where it is, which means the surgeon knows exactly where they're going if they're going to perform surgery to remove it. They know exactly the size of the problem they've got in terms of the depth and the width and the position of this tumour, but also the radiographer in positioning the patient to hit the tumour without hitting healthy tissue unnecessarily will know exactly where to put this then, because they know exactly the position of the tumour, which needs to be in the centre of the circle, as I said before. And here's your radiotherapist making decisions about exactly how to treat that tumour. And this would be the computer image of the beams being fired at the tumour. I don't know what that is. Just a reminder, low energy at this end, going up to high energy at this end of the spectrum.